Hello, today is Sunday, March 27th, 2022. I have a lower back pain from an, I don't know, sudden injury yesterday while I was trying to cut some roots with the scissors, big scissors. What is it called? I don't know, big scissors that you trim the branches of trees. It is called, I forgot the word. Um, you know, Mon lawn morning. I don't know. I was bending my upper body almost 90 degrees to pick something from the ground, and suddenly I felt some muscle cake breaking apart from the lower body. So that's why I started to have a back pain. It happens a lot. So I guess like a 7 days later, I would be okay.Maybe I need to lose some weight, especially around my belly or around my waist. That is straining my lower back muscles, I guess. So let's take a look into what the back strains are. And the reason I am reading this material is to practice English and also to pick up some interesting ideas and knowledge. This is purely for my daily English reading. It's purely academic effort, no copyright infringement intention at all. So here we go. Cleveland Clinic, back strains and sprains. A back strain is an injury to either a muscle or a tendon, while a back sprain is the stretching or tearing of a ligament. So we have muscle, tendon, and ligament. Back sprain. The symptoms, causes, and treatment of back strains and sprains are discussed. Overview. The back is a complex structure of bone and muscle, supported by cartilage, tendons, and ligaments, and fed by a network of blood vessels and nerves. The back, especially the lumbar or lower back, bears much of the body's weight during walking, running, lifting, and other activities. It makes sense then that injuries to the lower back, and such as strains and sprains, are common because it bears almost all the upper body weight at the lower back. What is a strain? A strain is an injury to either a muscle or a tendon. Tendons are the tough, fibrous bands of tissue that connect muscle to bone. Oh, I see. With a back strain, the muscles and tendons that support the spine are twisted, pulled, pulled pork, pulled or torn, twisted, pulled or torn. Back pain, injury to muscle or tendon. I don't have a coronavirus. It's just that I have a sore throat all the time since I'm twisting my neck trying to read this article while lying on the bed. I cough. I tend to cough some. So let's take a look at this interesting picture. Back strain, injury to muscle or tendon. Okay, so that's tendon. Tendon attaches muscles to a bone. Muscle. So muscle is torn apart. What is a sprain? A sprain is the stretching or tearing of a ligament. Ligaments are the fibrous bands of tissue that connect two or more bones at a joint and prevent excessive movement of the joint. So, ligaments, tendons, muscles. We know muscle because we eat beef, pork, muscles. Sometimes we eat tendons and ligaments too. But tendons, they attach muscles to a bone, while ligaments attach or hold the bones at a joint. So liga means strain or string of some sort. Back sprain, ligament stretch or tear, torn apart. Ligament tear. How common are back strains and sprains? Strains and sprains are very common injuries. Next to headaches, back problems are the most common complaint to healthcare professionals. What causes the symptoms and causes? What causes a back strain or sprain? Twisting or pulling a muscle or tendon can result in a strain. It can also be caused by a single instance of improper lifting or by overstressing the back muscles. A chronic long term strain usually results from overuse after prolonged repetitive movement of the muscles and tendons. Overuse after prolonged repetitive movement of the muscles or tendons. A sprain often occurs after a fall or a sudden twist or a blow to the body that forces a joint out of its normal position. All of these conditions stretch one or more ligaments beyond their normal range of movement, causing injury. In addition, several factors can put a person at a greater risk for a back strain or sprain, including curving the lower back excessively. Maybe that's what I did yesterday. I bent it over while trying to cut the roots of invasive vine trees at a chicken farm, and I think almost 80 degrees or 90 degrees. I bent it over my upper body torso. Being overweight, I am overweight around my waist. Well, when you are overweight, you are overweight around waist. Having weak back or abdominal muscles or tight hamstrings, muscles in the back of the thighs. That's interesting. Curving the lower back excessively, being overweight, that's what I am, having weak back or abdominal muscles, maybe I have never done sit-ups before, and or after the military service, that is, and or tight hamstrings, muscles in the back of the thighs. Oh, interesting. Thighs can impact the lower back. Playing sports that involve pushing and pulling, such as weightlifting and football, also increases the risk of a lower back injury. What are the symptoms of a back strain or a sprain? Symptoms of a strain or a sprain include pain that gets worse when you move, muscle cramping or spasms, sudden uncontrollable muscle contractions. Yeah, muscle cramping and spasms, decreased function and or range of motion of the joint, difficulty walking, bending forward or sideways, or standing straight. In some cases, the person may feel a pop or tear at the time of the injury. Or maybe tear, I think. No pop. I felt some like a back muscle cakes break apart from each other. Diagnosis and tests. What are back sprains and strains? How are back sprains and strains diagnosed? Mild strains and sprains can usually be diagnosed based on a medical history, including a review of the symptoms and how the injury occurred, and a physical examination by a healthcare provider. In cases of and a physical examination by healthcare provider. In cases of more severe strains and sprains, especially when there is weakness or loss of function, an X-ray may be taken to rule out a fractured, broken, or herniated bulging disc, hernia, bulging, hemorrhage. Hemorrhoid is seizure, hernia is bulging, disc as the cause of the back pain. There would be a serious problem. Management and treatment. How are back strains and sprains treated? The treatment of strains and sprains is similar and often takes place in two phases. The goal of the first phase is to reduce the pain and spasm. This may involve rest and the use of ice packs and compression pressure, especially for the first 24 or 48 hours after the injury. An over the counter nonsteroidal anti inflammatory drug, such as ibuprofen, Motrin, may be recommended to help reduce pain and swelling. Over the counter nonsteroidal anti inflammatory drug. That sounds okay. Maybe I should take that because I feel uh, some muscle strains or sprains on my left upper arm, the arm elbow. They would handle the case. After the first 24 and 48 hours, returning to normal activities as tolerated is advisable. Extended bed rest or immobility, non movement, simply prolongs symptoms and delays recovery. That sounds interesting. Instead of a bedridden, you need to walk, play, and return to the normal activities. Let's read this uh, phrase one more time. After the first 24 and 48 hours, returning to normal activities as tolerated is advisable. Extended bed rest or immobility, non-movement simply prolongs symptoms and delays recovery. Most people with lumbar sprain symptoms improve in about 2 weeks. If symptoms continue for more than 2 weeks, additional treatment may be required. What complications are associated with back sprains and strains? The most common complication of a back strain or sprain is a reduction in activity, which can lead to weight gain, loss of bone density, and loss of muscle strength and flexibility in other areas of the body. Prevention. How can back strains and sprains and strains be prevented? It is not possible to prevent all back injuries, but you can take some steps to help lower the risk of a sprain and or strain. Eat a healthy, well-balanced diet to keep your bones and muscles strong. Maintain a healthy weight. Excess weight puts added stress on the structures of the low back. Exercise regularly, including stretching, to keep your joints flexible and your muscles in good condition. Practice safety measures to help prevent falls, such as wearing shoes that fit properly and keeping stairs and walkways free of clutter. Use good body mechanics when sitting, standing, and lifting. For example, try to keep your back straight and your shoulders back. When sitting, keep your knees bent and your feet flat on the floor. Don't overreach and avoid twisting movements. When lifting, bend your knees and use your strong leg muscles to help balance the load. Stop smoking. Nicotine interferes with blood flow to the muscles. Yeah, I don't smoke. So use good body mechanics when sitting, standing, and lifting. For example, try to keep your back straight and your shoulders back when sitting. Keep your knees bent and your feet flat on the floor. Don't ever reach and avoid twisting movements. When lifting, bend your knees and use strong leg muscles to help balance the load. Stop smoking. Nicotine interferes with the blood flow to the muscles. Outlook prognosis. What is the prognosis outlook for people with back strains and sprains? Most people with back strains and sprains have a full recovery with treatment within 2 weeks. Living with when should I contact my healthcare provider about a back strain or a sprain? Call your healthcare provider if you have severe pain and cannot walk more than a few steps. You have numbness in the area of injury or down your leg. You have injured your low back several times before. Yeah, I did. Uh, you have a lump or area with unusual shape. Oh, not me. You have pain that interferes with sleep. You have obvious weakness in an extremity, hands or feet after an injury. Yeah, that sounds like a nerve damage. Last reviewed by Cleveland Clinic medical professional on November 9th, 2018. Get useful, helpful, and relevant health aware. So basically, strains and sprains are similar. Sprains is the damage to ligaments, while strains to tendons. So tendons, muscles are cartilage and ligaments. Okay. Uh, so I feel stupid enough because I encountered these back pains like at least I don't know 3 to 6 times in my life so far. Mainly because I am overweight around my waist and I haven't practiced stretching exercise recently. Even though I learned the five elements of Fralex and I go for anti-cancer Tai Chi walk. I'm very shameful of me. I need to shed some weight, a lot of weight around my waist. I'm trying to cut down on my supper. I am not. I am trying not to eat my dinner at all for the next 1 or 2 months. I have that experience. I lost like a 2 inches of waist length. My belt decreased by 2 inches. Related institutes and services: Neurological Institute, Anesthesiology and Pain Management, Orthopedic Rheumatologic Institute. More health news plus info. Enough sleep. How long should you nap? That's interesting. Blog news and apps. Actions, appointments and access. Accepted insurance. So, what are the words and expressions that I learned from this interesting article? Back pain, ligaments, tendons, muscles, cartilage, prognosis, diagnosis, injury. I need to put my feet on the ground flat. I usually cross my legs. Maybe I'm anxious while I on my desk. So I need to have my shoulders pulled back, my back straight. I need to be extra careful when I make a twisting movements, and also I need to lose a lot of weight. I am overweight, and I have this pain in multiple times. What else? What else? Treatment: tendons, ligaments, sprains, Cleveland Clinic. Symptoms, causes, and treatment overview. Sprain, joint, excessive joint. Well, that's it. Thanks for listening. Have a good night.